Everything looks bad on me and everything's uncomfortable. Which actually reminds me, maternity tights are the bomb. Pretty much all along in my pregnancy, and I'm now in my 7th month, there have been, you know, various different symptoms that I've encountered. My doctor did approve all of the things that I'm gonna share with you, but everyone's different, so don't just listen to me, talk to the medical professionals. Generally, in the very beginning, in the first trimester, one of the first symptoms that you'll have is nausea. If you're lucky, it's not too bad. Like me, I never actually threw up, but I wanted to many, many times. And there were a few days where I just really couldn't get out of bed, and it strikes at any time. But the most confusing thing about it is that usually when you get nauseous, it comes along with like intense hunger. So I put some saltines next to the bed. If you wake up and you're suddenly starving, you could drop, you know, because the last thing you want to do is let that hunger take hold and turn into nausea. But if you can't avoid it, there are a couple of things that I found to be really helpful. The first one was tummy drops. These are a peppermint flavor, but they also have ones that have ginger or like berry ginger mixtures. And these I just ordered on Amazon. My sister told me about them. She's on her 3rd pregnancy, so she knows. In the very beginning, your doctor, and probably like every other woman you know in your entire life, is going to tell you you need to take prenatal vitamins. I had seen this company, they had a pop-up near my house. What I really liked about it is it's just a subscription, so I don't have to worry about going out and buying them every month. And this is Ritual. This is their prenatal. They do all sorts of different vitamins. As you can see, it's quite cute. The capsules are clear and you can see basically what's inside. And I don't know, that's kind of cool. They're very, you know, transparent about what they're putting in there. Also, these have an orange scent, like a citrus, like lemony orangey scent, which is actually really, it makes it a lot easier when you're, like I said, if you're experiencing nausea and you have to swallow these, that kind of helps it go down easier. Now in pregnancy, getting dehydrated can be even more serious, like really, really serious, more than you would ever think. I think it was towards the end of the first trimester. I started cramping up really bad, like felt like menstrual cramps, feeling like I have, you know, a bladder infection, hurts to pee. I made them test me twice for a bladder infection. They're like, no, but you're dehydrated. You're really dehydrated. And you know, that kind of thing can really cause pain in pregnancy because, you know, your bladder and your bowels and everything, they're squished by this baby. So if you're not supplying them with enough, you know, liquid, enough like hydration, they become inflamed very easily. It's also really dangerous for the baby. So the doctor said, if drinking a lot of water all day long is really boring to you, then make sure you get some other stuff that you like. So, hello Costco. I've been drinking a crazy amount of Gatorade, which I'm gonna crack one open while I talk to you right now. This is what I do. I'm just constantly drinking liquid. Like, you'll be shocked how much liquid you have to drink. It's insane. I get Gatorade, I get coconut water. You know, I used to love sparkling water, and now because there's a lot of acid reflux situation going on, which I'll talk about in a minute, anything bubbly is not great. So speaking of acid reflux, it has been the constant symptom that I've encountered throughout my pregnancy, and I talked to a lot of ladies who agree. It's brutal. It's so very, it's painful. Like, I've never had this kind of acid reflux in my life. One of the only things that you're allowed to have as a pregnant woman is antacids. These are just the Rite Aid brand, but you know, Tums is another one. And you can see this is 160 tablets. This is my 2nd one of these in this pregnancy. Those are a pregnant lady's lifesaver. Trust me, get the big size. Early on, I got a lot of like bad headaches that just lingered. They don't want you to take Advil and Motrin and all these different things. But they do say you can take Tylenol, just regular extra strength Tylenol. It does a little bit, you know, it helps. Let me just go ahead and, I should try to finish this whole thing before the video is over. then I would know that I'm being good. I have a doctor's appointment too later, and they'll make me pee in a cup. So I don't want to be embarrassed by being dehydrated again. It was like, they look at you, they're like, really? I'm like, My fiance can't believe it. He's like, no one drinks more water than you. I'm like, that just shows you need to drink so much water and liquids when you're pregnant. No one talks about it. Like, you'll be shocked. I was given a gift early on from the company Hatch Collection, which you may have heard because they have the cutest maternity clothes, which I like totally splurged on, and it was worth it. Because sometimes you just feel like a total slob. I remember having a meltdown one day. It's like, everything looks bad on me and everything's uncomfortable. Which actually reminds me, maternity tights are the bomb. I am telling you right now, my fiance doesn't understand it. He's like, I don't understand, why is it more comfortable to have something like around your belly? Because can you see this? They come up all the way like over your belly, like right underneath your bra line, basically. But the fabric that they use when they're made is like, it's stretchy, but it's also not like, the elastic is not intense. It's like a very loose elastic. So it really just kind of lets you be. And then it looks really cute to have your maternity tights with all the little like tunics and like kind of longer flowy tops that a lot of these maternity brands sell, which I've loved, and I wear them with like my riding boots, and people are always like, oh my gosh. So maternity tights, I own like 3 or 4 pairs already, and I basically just rotate them through every week. I really don't want to wear anything else. I have some dresses, that's cool too, but these are my go-to at home, just comfortable things that make me feel like a normal person. Hatch also makes a belly oil and a few other products for skincare for moms. And they have a bundle that one of my friends gifted to me. So in the bundle is belly oil, which is like the #1 product I think that everybody wants. I, use like probably 2 of these droppers on my belly after every shower. Another important thing to do is don't just make the belly. There are other parts of your body that are stretching right now. Your breasts, your hips, your thighs, they're all growing to accommodate this baby and this life that you're growing, which is so exciting. So make sure you moisturize all of that too. It helps to take care of yourself in this way. It really feels good when you have, little aches and pains and feeling strange. It's like, you know what? Take a bath, lather yourself up, and feel good about it. Have some tea. Have your boyfriend or your husband go get you some tea, and it'll be great. Belly oil is part of that. Also in the bundle comes this soothing leg and foot relief. So this is like a cream which has like a peppermint scent, like a tea tree maybe. And it does have a like cooling effect. So it's made for your feet and your legs. I'm gonna put it on my hands right now because I'm all covered up down there. It smells really good. It's like spa smell, and it's a lovely moisturizer, and it has an immediate cooling effect. So I found that in my 3rd trimester, I'm starting to get really hot, which is like kind of weird for me because I'm always freezing. And so this is really nice. You can just kind of smooth some of this on. It's supposed to help with like the restless leg syndrome that some women get as well. I don't really know about that because luckily I haven't had that, but I still find it a really nice product. And then the final thing that's in the bundle is a nipple and lip balm. And I haven't used it on my nipples yet. Too much information. But it's like great on the lips. So apparently when you start nursing, you need extra protection in that area. So I'll have to let you know if I recommend it once the baby's here too, but it is really nice on the lips. And like I said, why not pamper yourself in whatever way? I have so many like balms and creams. I do them all at night, and then I'm like in bed, like tucking like 18 pillows around me. I'm like, yes. Sleep is the ultimate luxury at this point. I never was a huge bath person before this, but being in the bath really soothes and calms you. And I think that, you know, when you are carrying this extra weight, the water kind of holds you up a little bit, so it really takes pressure off of your back. One of the most fun things that I have are a bunch of these bath bombs, which are from Lush. Basically, these guys make like these things you stick in the bath and they like fizz up, and here's one of them. This one's like in plastic or in paper because it's super glittery. It's the last one I have left from like 6 of them that my friend gave me for my birthday. And it's so fun to stick one in and just see it go, and it, you know, smells amazing. And like a lot of them are like bubbly, or, you know, I just had one last night that it was like really hydrating and had oatmeal in it. I loved that one. It was so good. Again, pamper yourself, do these things. It really does help when you've had a long day and you're like, oh, I'm so overwhelmed, you know, trying to like get your nursery together, or, you know, plan a shower, or, you know, just get through normal day stuff. Like I haven't grocery shopped in like 2 months because it's just too much. There's just too much going on. You know, at the end of the day, you can really feel worn out. I strained my groin the same time that I started cramping, which was 2-3 weeks ago, right at the beginning of the 3rd trimester. Now I'm kind of thinking it could have been a growth spurt, because also now everyone's like, oh my gosh, look at you, you're pregnant. And they never noticed before. And so I think maybe the baby had a growth spurt, and it just, your body is trying to adjust like all this extra weight, and it's really hard. Plus there's this hormone called relaxin that starts going through your body when you're pregnant, and it's made to loosen your joints so that, you know, basically the baby can fit out. And that's great, except for when some joints get loosened and, you know, your body is kind of built, and your muscles and, you know, your ligaments are built in a very balanced way. So when some of them loosen up, more strain gets put on others, and you have to be really careful. I've been like, you know, a crazy workout fanatic my entire life, and during the pregnancy, I have barely worked out because it doesn't feel right. It doesn't feel good. Like even just, you know, if I'm walking Rooney and she's like she sees a squirrel and she wants to like run for, you know, half block, I can feel it in my groin. I'm like, no, not good. If you have those kinds of issues, the good old-fashioned hot water bottle, it just helps. It's just soothing, you know, like a combination of all these things. You know, if you're not feeling well, a little Tylenol, a hot water bottle, a bath, you know, you can really help yourself. Sometimes it feels like, oh, what the heck? I'm not allowed to take anything or to do anything. And, you know, everyone's always like, don't worry, the baby's fine. I'm like, great, I'm glad she's fine, but what about me? Is it gonna be like this forever? This is something that people also probably won't want to talk about because it's kind of embarrassing. But like I said earlier, when I got dehydrated, you know, I felt like I had a bladder infection, but it wasn't a bladder infection. The same sort of issue can happen if you're constipated, because like the baby is like right there. I mean, the doctor showed me on my ultrasound, she's like, look, here's the baby's head and here's your bladder. And she's like, and your bowels are right there. She's like, so you can see why, you know, if you don't like, you know, preserve a proper function of those parts of your body by being hydrated and, you know, making sure that your bowel movements are normal. Sorry, but it's true, guys. And this is something that's so important. It doesn't matter if it's embarrassing, because it's like really important for your comfort and for your health. Then, you know, it makes sense that you would have pain in those areas. So she said, you know what you should do, and what I recommend to all of my patients, is that they take a daily dietary fiber. And, you know, she recommended just the good old normal Metamucil. This is a giant thing that I'm making my way through very quickly because I have a spoonful of it mixed in 8 ounces of water every single day. And this has been amazing. Like, I have friends that are telling me, that have told me, you know, that they had terrible hemorrhoids and that they were super constipated while they were pregnant. And I'm like, well, why didn't you take fiber? And they're like, oh, I don't know. I thought I wasn't allowed to. I'm like, girl, my doctors told me I have to do this. And I have to tell you, I'm so glad that I did. I'm also now taking an iron supplement, which also is known to have a very common side effect of making you even more constipated. So this is a problem for pregnant women that people just, they don't want to talk about, but you know, don't suffer in silence. Just get some of this, I'm telling you. When you start to feel a little extra weight, there's different things that happen, and different symptoms that happen. And I think one of the first things that happened for me was my tailbone got really sore. This was maybe a couple months ago, in the middle of the second trimester, when you start actually like adding a lot more weight. I've gained like 30 pounds. And my tailbone from sitting, because I work at the computer a lot all day, oh, it was so bad. So I got a couple of pillows and things, and I was joking, the pillows are all in the shape of different letters. You'll find there are different letter pillows for different things. The most popular letter for tailbone issues is O, you know, and they have like inflatable ring pillows and different stuff like that. For some reason, those didn't sound as comfortable to me as this U-shaped pillow. So this is made of memory foam. So it's like really, really soft, but also supportive. And this particular model has like a layer of gel on the top of the foam. So that kind of was like, ooh, that sounds good, because, you know, it sounds a little hot to like sit on a foam thing all day long. And it actually is very cooling when you sit on it. Yeah, this is the front, like this is where your legs go. And so your tailbone sits right here. And so it's relieved of the pressure. And this has been amazing. I go to classes and I don't usually take it to meetings. If I'm gonna go sit somewhere for more than 2 hours, I bring it. And I'm just like, whatever, I don't care. Judge me if you want, I don't care, I'm comfortable. My tailbone isn't gonna hurt today, no way. This is also a U-shaped pillow, and it's made for, primarily I think it's made for sleeping. And you're supposed to like put your head here, right? And then this goes behind you, and you can like put your leg over the top like this, and you can, I tried that for a couple of nights and it didn't work for me because I'm a down pillow girl and this is not down. And I was like, no. So I could probably put my head at the bottom and not have that issue and just use these to support, you know, because what I found is really nice to like have something under your belly when you're sleeping on your side. Otherwise, like you actually feel like a pull and there's a strain, there's like various strains. So whether you use something like this or whether you just use, you know, more pillows of your normal pillows, tucking something under your belly when you're sleeping on your side is great. What I tend to do is I put one on one side of me and one on the other side of me these days, so that when I switch from side to side during the night, I have one right there ready to go to tuck under. I'm gonna move it over under the covers, which is like always a hassle. I also sleep with like 3 pillows behind my head, because that helps with acid reflux, which tends to strike at night. So I'm not using this for sleeping. What I am using it for is like sitting, you know, if I'm in like, you know, there's a big chaise lounge in the other room that I like to perch on to do my computer work during the week. And I'll put this like on it with a bunch of pillows behind it. And then I'll like wrap these around and, you know, kind of create a cocoon for my lower half of my body. And it just, you know, every little support on this side or that side, it seems to help. Every pregnant woman I've talked to tells me that more pillows is better. Yana pillow, YANA. So I found that one of the things that is highly recommended for women who are experiencing different like muscle strains throughout their pregnancy is a belly belt. Like a maternity belt is another word for it. So I got one of these. Gosh, yeah, it's the Neotech. And this is one of the most highly recommended ones. Some of them are one piece, but this one is 2-piece, and they'll have instructions, but basically the first thing that usually goes on is around the front, and then you have to secure that, and this is just done with Velcro. Where is this? Oh, there we go. Okay, so there. So I've got this under my belly, and around the back like that. And then this big piece is to support my lower back. So, and you can see it says up. So I'm gonna put that there, and it kind of makes sense when you get it around there. Ah, that's the way. And boom. So that's kind of the deal. So basically what you're feeling is that this bump is being lifted up. It's a little more intense looking, which makes you not want to wear it outside unless you have like a tunic over the top of it, then no one would ever know. There are like more low profile ones that don't look as much like a medical device, but I started wearing this at home. And then I also started doing a lot more prenatal yoga stretching. My groin strain now is like almost 100% better, and it's great. And so I do want to mention that yoga has been amazing. The types of yoga that have been really helpful to me are very, very chill. You know, there's no like flowing power yoga. It's just getting on your mat and stretching out those muscles, which are getting a lot of strain put on them by this extra weight of your pregnancy. So a lot of things that stretch out the hips, the inner thighs, the groin, you know, like low lunges, those kinds of things, supported low lunges. Those are really, really nice. And usually I get my mat, I get a block, because, you know, even more so than when you're just doing yoga as a normal person with no other person inside of you. These are great for, you know, safe practice and supported practice. But when you're pregnant, like, you just need more support, like I said, with the pillows. So I always use my block, and then I always use like 2 or 3 throw pillows. Just something like this, you know, is great. You can, you know, see what works best for you, what you have around, but, you know, use things to support you. So I feel good. I feel like I shared all of my secrets, and I hope that they're helpful for you. The bottom line is, you got to take care of yourself. Everyone's going to say, oh, you know, you're eating for 2. Oh, make sure that you take care of that baby. And of course you want to take care of your baby. Like, that's the #1 instinct. You don't need to tell expecting moms to take care of their baby, because that's all we think about all day long is like, are you okay, Mary? Don't forget about yourself. You know, when I was experiencing pain, my doctor was like, I was like, but is the baby okay? Is the baby okay? And she's like, the baby is great. She did a little ultrasound. She's like, she's perfect. She's like, you know, don't worry. Like, mothers really take the brunt of these things. Like, if there's not enough, if you're dehydrated, the baby's going to get all the hydration first, and you'll be deprived. And then it's not until it gets that severe that the baby actually like starts to be deprived also. So you're feeling terrible. She's very comfortable in her little cocoon. She's just like totally oblivious, like, oh, everything's great. So, you know, just don't forget to take care of yourself. It's so important. And, you know, I think it's good practice for when you actually do have your child, because it's going to be your #1 instinct to just do everything for the child and, you know, give of yourself endlessly, and for your partner probably too. So, you know, everyone says moms never think of themselves first. And I think that, you know, you need to kind of try to counter that a little bit, because we really can't give if we're not cared for and replenished. So those are the products and things that have been helpful to me up to this point. I'm now pretty well into my 3rd trimester, and I hope that you found that helpful. It's been nice hanging out with you guys. Don't forget to like and subscribe for more content like this. Mwah.